This is Dr. Boden, Scott Boden from Hartford, Connecticut. And we're in an extraordinary time right now with this coronavirus pandemic affecting the world. We are open. We're open for virtual consultations. We are doing medical follow-ups. We're utilizing telemedicine via Skype or FaceTime or WhatsApp. Some patients are using Zoom. So I'm available. We do continue to provide ongoing medical care for our patients, and I am happy to meet new patients that want to reach out during this time. We're following CDC guidelines. We're following guidelines from the governor of the state of Connecticut, and we're not doing any elective surgery, so we have not done elective hair transplant procedures since the middle of March. And it's very difficult to know when we're going to reopen. I am optimistic that we'll be able to reopen within the next month or two. I wanted to assure you that we have been doing everything possible to maintain a clean, healthy, sterile environment here in the office. My staff are still on the payroll. I think this is very important. Everybody has needs to support their families. I'm sensitive to that. I'm obviously sensitive to the good health and well-being of my patients. So we are at this time seeing patients virtually. The phones are open. My staff is ready to take your call, and we can schedule virtual follow-up appointments with me. And we're accepting consultation requests, and I am seeing patients. It's been an interesting time, obviously unprecedented time. Some of my patients that had been scheduled over the next several months are of course choosing to delay their procedure, and we have postponed the procedures that we had scheduled. But it's interesting in that I've had a number of patients reach out saying, this is a great time for me. I'm healthy, I'm well, I've got a month off from work. I never get that. So there is an important sense that this may be a time to come back, re-enter the workplace in as strong a position as possible. I'm very respectful of that. However, we are not doing any elective procedures. When this ban lifts and we're all safe, we are going to continue safe precautionary measures in the office. Everything has been thoroughly wiped down and scrubbed, and we're prepared to have patients here. We typically will see one surgical patient a day. There's an extremely low risk of any cross-contamination. We do not have a lot of traffic. But I do wish everyone be well, be safe, be healthy. Please feel free to reach out. We're here for you and in good health.